Hello, and thank you for joining me today as we look at mental health across the lifespan. We will be talking about several populations, such as the elderly, those in the perinatal period, pediatric and adolescents, LGBTQ+, immigrant and migrant workers. Before we move on, I would like to discuss the importance of providers providing culturally competent and appropriate care. This will ensure that you are providing respectful, safe, and appropriate care to all individuals. As we move on to looking at the geriatric population, as future providers, we must educate our patients and families that depression and anxiety are not normal parts of aging. It's estimated that patients aged 50 and older, around 13.9%, have a mental illness. This is expected to increase as the baby boomers continue to age. Oftentimes, mental illness can go under-recognized and untreated in the geriatric population, such as they may have an inability to get to the doctor, like they can't drive, or they may live far away from a healthcare facility. There's also social stigma, especially in older generations where mental illness may be seen as a weakness. Also, mental illness symptoms may be easily missed or attributed to old age, such as fatigue, lack of appetite, and worry or anxiety. So why or what factors contribute to mental illness in the mature population? Well, they could be suffering from grief from a loss of a loved one. As one gets older, many individuals start losing their friends. In addition, they may have reduced mobility or the inability to drive, which will increase isolation as it is hard to get out of the house for social activities. They may feel old and upset or discouraged that their aging body may have multiple comorbidities. Due to complications of aging, they may feel defeated, that they are no longer able to maintain independence, such as taking care of their house or even self-care. Proper assessment for geriatric assessment helps to rule out other conditions that can mimic mental illnesses. In addition, it's imperative to choose a tool that has high sensitivity. So the Geriatric Depression Scale, or GDS, can be used to assess feelings of depression over the last week. There's both a long and short form questionnaire. The short form can be utilized for those who are very ill or have a limited attention span, such as individuals with cognitive decline, which may be seen in someone with dementia. The GDS has a 92% sensitivity and an 89% specificity when compared to the DSM diagnostic criteria. In addition, the long and short forms both were able to differentiate patients who were depressed versus not depressed with a p-value of less than 0.001. We're looking at treatment for elderly individuals that may have a mental illness or condition. There's many things we have to keep in mind, as there are many changes that occur as one ages that may affect how the medication works. For example, when we look at the pharmacokinetics to the absorption, distribution, metabolism, and excretion of the drug. For example, decreased nutrition can contribute to poor protein stores that lead to a decreased amount of plasma proteins. This can cause an increased metabolism of the drug since it's unbound to plasma proteins, which increases the drug secretion. If the drug is not bound to a protein, it can lead to uneven drug concentrations. We can also look at the pharmacodynamics, which is how the drug interacts with biological structures or targets at the molecular level, which creates an action and effect of the drug. So how internal body structures will affect how the drug breaks down and works. So in addition to pharmacokinetics and pharmacodynamics, there's other factors to consider, such as polypharmacy, which is a big consideration for the elderly. Polypharmacy is the prescription and use of multiple drugs or prescription drugs for one individual. This will increase the risk of drug-to-drug interactions, increase side effects from the drugs. So when you're prescribing, you need to consider the life expectancy of the individual. Is the benefit versus the risk worth taking the medication? And what is the patient expected to gain from taking this medication? Also, we want to look at the goals of care of the patient. Do they want to take medication? What would they like? And it's very important to consider. Also, we want to look at the Beers criteria. And this is a list of medications that are grouped into 5 different categories that have the potential to be inappropriate for geriatric patients due to the increased risk of adverse events. So you want to make sure if you're prescribing something, is this on the Beers criteria? And if it is, you may need to consider, is it truly needed or can you choose a different drug? In addition, it will show you the different interactions between drug-to-drug interactions as well. Some non-pharmacological treatment for the elderly would include increasing social activities. Is there a bus that could come pick up the patient and take them to a senior center for the day to increase communication and interaction with others their age? Increase a healthy diet. Oftentimes, if the patient and their spouse is deceased, so cooking for one can oftentimes not be fun. So they might be eating less, either because they don't like to cook anymore, they struggle to cook, or they can't afford the food. So you want to try to make sure that they are having a healthy diet and increased sources of protein. Low impact exercise can be a great way as well to at least release endorphins, such as maybe going for a walk, even if they did 5 minutes at a time and did that 5 times throughout the day. Low impact exercises such as swimming, they can do chair yoga. Also, if they are religious and practice a certain faith, getting involved with the congregation can also help to bring socialization and community. There's also techniques such as art therapy that can help the individual explore different emotions that they may be having and have a creative outlet. And also, if they do have a problem with mobility and getting to doctor's appointments, you can offer telehealth counseling if they do have internet access and a computer, so they can work on some counseling, talking through their feelings, and come up with some healthy coping strategies. Next, we move to the perinatal period, which is a period of time that is full of changes. It symbolizes the time of expecting with the child all the way up to 1 year after birth. So during this time, you're adjusting to the idea that you're a mom as you're pregnant, adjusting to the new body image and increased level of hormones, among other changes. And then after birth, not only does the infant have to get used to life outside of the uterus, then there's also the physical complaints after birth that the mother may have. The baby is learning how to feed. The individual is learning how to feed the baby. The parent is on a lack of sleep due to baby trying to adjust to extrauterine life and learning how to start adapting to day and night and establish a sleep schedule. Not to mention the hormonal shifts the person after birth may be experiencing. In addition, during this time, the individual may choose to utilize the breast milk to feed the baby. And this can take many different forms. There people that choose to exclusively breastfeed. They do a combination of breastfeeding and bottle feeding, either with pumped or expressed breast milk or with formula. There's also something called the SNS supplemental nursing system, which is a system that helps the baby to get more milk when they're having difficulty latching or getting enough of a supply from the mom. So it's helping to stimulate and send the receptors and the message to the mom's brain to not only to produce more milk, but then also we're making sure that the infant is getting adequate calories and nutrition for the developing brain and body. Also, there's pumping and bottle feeding either with breast milk or with formula. As we talked about in the last slide, the perinatal period is full of changes, both for the parent that gave birth as well as the infant adjusting to life outside the uterus. So usually, typically, the postpartum visit is at 6 to 8 weeks postpartum, which is quite a while after birth. During this time, though, the pediatrician is frequently assessing the infant, making sure they're gaining weight and doing well. So this is also a great opportunity for the pediatrician to touch base with the parent that gave birth, see how they're doing, and check in on them. If there are concerns, this would be a great time for the pediatrician to make appropriate referrals. Some ways to assess and see how the parent that gave birth, how they're doing, is you can use a tool called the EPDS, which stands for the Edinburgh Postnatal Depression Scale. It can be used both during pregnancy and postpartum to assess for depression. So the scale and tool asks mothers how they have been feeling within the last 7 days. During this time, there's a range of emotions. The mother or individual may have a range of emotions due to the recent changes and hormonal fluctuations like we talked about. So the most common, around 85% of mothers experience, is called the baby blues. And this can usually be seen within a few days of delivery, but it typically resolves around 2 weeks postpartum. If we delve into this farther and more acutely, there's perinatal depression. This can occur during pregnancy or for up to 1 year after pregnancy. And this can be seen in 1 in 7 women. There's also something called perinatal anxiety, which can again occur during pregnancy and up to only 6 weeks after delivery. There is a risk for PTSD, post-traumatic stress disorder, and this could sometimes be more prevalent in individuals that have had a sexual trauma, or they've had a traumatic birth experience, or a stillbirth. Also, the individual can have symptoms of OCD, obsessive compulsive disorder, or something more serious, which is psychosis. And their individuals can be more at risk for this if they have a prior medical history of bipolar disorder. So you must watch the patient carefully, especially if they are sleep deprived, which is most parents after a newborn, but especially if they are sleep deprived for over 48 hours. So if we discover a mom or new parent is struggling with their mental health, what can we do to increase support for the individual? So is there someone that can help with childcare so that the mom or patient can get some sleep and rest? Is there somebody that can help with bringing meal delivery so the parents don't have to worry about cooking dinner, going to the grocery store when they're tired, and trying to adapt to a new infant? If the encourage mom. So these are all important non-medication tips that you can give a new parent. But for more extreme cases and a more well-rounded approach, you can also suggest counseling. So you can encourage the patient to attend counseling either in person or via telehealth. Also, if they use counseling with antidepressants, research has shown to have greater efficacy. Now, you do have to have some consideration. If the patient, the provider, both agree that antidepressants would be the next best step for symptoms of depression and anxiety, it is important to know that Zoloft could be considered first line if pregnant or breastfeeding, that there's been little harm to baby or mother during this time. But all providers need to discuss with the patient the risk versus benefit of treating or not treating. And again, using a shared decision-making conversation. Now we move on to the pediatric and adolescent population. It is estimated in 2021 that 1 in 5 children between the ages of 3 and 17 have been identified as having a mental, emotional, or behavioral condition. So, why are these cases? They could actually even be higher than this due to a significant amount of undiagnosed cases, either due to the inability to access healthcare, fear of stigma, or denial of the parent. So why are pediatric patients and adolescents struggling with mental illness? Well, there's multiple factors that can lead to this. So there's social media, and so on social media there can be an increased presence of online bullying due to identification of the bullies online, so they feel like they can maybe say whatever they want without consequence. There's also filters, and people are only going to post about the good times usually, not the bad, so that develops these unrealistic expectations that young children can idolize and think that they have to be that way. Social media, it's kind of an oxymoron where you think, oh, you're being social, talking on the internet, but actually it's more increased isolation. It's this front of being in a community, but oftentimes it's more isolating. And also research has shown that there is an increase of mental illness the older the patient or the adolescent becomes. So as providers, we have to be in tune to what the parents are saying, pay attention to the child during the assessment. If there are concerns for developmental delay, mental health condition, or frequent complaints by school or daycare, this is when we need to hone in and consider who we need to assess and how. So we talked about during the physical exam, you want to make sure you're taking a thorough history first. So you want to find out the child concerns. You want to ask the child directly, and you can use both a combination of closed and open-ended questions. So, if you just say, are you having any problems at school? The child can just say no. Well, it's so broad. Problems where? Problems how? So you could use more detailed questions by saying, are you having a problem with bullying? Are you having a problem studying for your test in school? Are you having a problem staying on task and focused? Then you can ask the parent or the guardian, do you have any concerns? Have you received notes or calls from the school or daycare? Is there evidence? Have they brought in a report card showing they were a great student and now they're falling behind and in danger of failing the class? Has there been multiple write-ups or behavioral incidents that's required administration to get involved? Then you want to continue the assessment and ask about family history, both either of mental illness, behavioral problems, emotional concerns. You also want to ask the guardian about their perinatal history. So did they take prenatal vitamins? Did they have any difficulty during pregnancy? Was it high risk? Was there drug or alcohol use? Was there medication used during pregnancy? Was there any trauma during pregnancy? Try to get a very detailed history of how it was during that perinatal period. What type of diet is the child consuming? Try to get a great idea of breakfast, lunch, and dinner. Also, is the child and family going through major or stressful life changes? This can also, if so, the child could be acting out and trying to process this recent change. So during the assessment, you took a very thorough history. As the provider, you also want to rule out other conditions that could be occurring physically that could mask or present as a mental health condition. So as a provider, you could look at ruling out diabetes, thyroid conditions, insomnia, decreased nutrition, and a stress response. So oftentimes there's some common mental health concerns that you can see in pediatric patients. So we can look at here at the ADHD, if there's concern for that, either from parent or teacher. You can use a system checklist. And so for a child to be diagnosed with ADHD, it has to occur in 2 or more settings. So if the parent says this just happens at school, well, that's not criteria for it. Maybe the student is not challenged with the material, so they get bored. So 2 or more settings that cause impairment in those settings. So if the child is between 4 and 17 years old, they need at least 6 symptoms from the ADHD checklist. If they're 17 and older, they'll need at least 5. Generally, these symptoms have persisted for more than 6 months, and the parent or guardian has noticed them before 12 years old. Another common mental health condition that you can see would be depression. And you could see symptoms from a child such as isolation, difficulty with sleeping, difficulty staying on task and focusing during school, having a hard time keeping their grades up. They could have weight changes, either gaining weight or losing weight, a withdrawn, more isolated behavior, increased lethargy, decreased motivation to do simple tasks. They mention or talk about feeling very guilty and sadness, maybe cry more than they have in the past. If you see these signs, it's important to screen the child and talk to the parent to see if further intervention is needed. Also, so the United States Preventative Services Task Force recommends screening for anxiety for children 8 through 18 years old and depression screening from 12 to 18. But also it's important to use your clinical judgment as a provider to determine if additional screening is needed. For example, for conditions such as eating disorders, alcohol use or abuse, tobacco use or vaping, drug use, prescription, and illicit drug use. If you have suspicion, then that would be appropriate to conduct further questioning and screening for that child. So once a mental health concern has been identified, it is important to have with the patient and the family a shared decision-making approach. So you want to weigh the risk and benefit versus treating versus not treating versus using medication, not using medication, and what the goals are of the patient and family. If, for instance, the patient decides to use medication for ADHD, discussing and educating about drug holidays can be particularly insightful for the family that the child would stop the medication during a longer break, during Thanksgiving or winter break, and during summer breaks to help reduce increased dependence that the body may develop, and also to allow the child to catch up on weight gain and growth measurement, because sometimes these physical development can be stunted while on ADHD medication. Discussing the importance of using cognitive behavioral therapy, both for the patient and or if there is a need for family therapy to help work through particularly stressful cases, and how to utilize skill building and positive coping strategies. For the individual, it would be great for the provider and also the counselor to offer and educate on the importance of having positive outlets both for the child maybe that is hyperactive or suffering from depression or anxiety. So art therapy can be a great outlet. Enrolling the child in recreation leagues, anywhere from dancing, flag football, basketball, golf, tennis, a hiking group, art class, listening to music that the child likes, writing poetry, going on walks with a friend or family member, drawing with chalk, coloring, or doing crafts are all a great way to help relax the body, increase self-confidence, and just have a way to tune out the other stressors that the child could be experiencing. So during this time, you'd want to talk about, we briefly mentioned a minute ago, about the side effects of ADHD medication. So the parents need to be aware of side effects and what to look out for and when to notify you. So the child may have trouble sleeping, so there may be need to give the dose earlier in the day and or adjust the dose to a lower dose. The child is pretty much expected to have a decreased appetite, so it would be some good education would suggest taking the medication first thing in the morning after a really nutritious breakfast full of protein, snacking throughout the day, and as the medication starts wearing off, again, have a really nutritious dinner. This can stunt the growth, so as we talked about before, taking the drug holiday and educating the family on that. Depression medications can be used. So there are some SSRIs that are FDA approved to help children and adolescents that are struggling with depression. So Prozac is one. Also Lexapro is FDA approved. There are anxiety medications that are also FDA approved for 7 years old and older. And so there's SSRIs and SNRIs. So again, it can be the approved medications, Prozac, Lexapro, Cymbalta, and then for OCD, you can also use Zoloft. Side effects of the SSRIs and SNRIs can vary, but common symptoms can be insomnia, drowsiness, GI side effects such as nausea, diarrhea, GI upset, decreased or increased appetite, nervousness, headaches. This is not an exhaustive list, but some pretty common symptoms to be aware of. Also, you want to educate the parent if there is a display of manic behaviors, irritability, or increased depressive symptoms, talks of self-harm or homicidal tendencies. That would be some red flag symptoms that we'd have to go to the ER and seek emergency treatment. Now we move on to the LGBTQ plus group. And I think it's important to note that the initials that I just listed are not an exhaustive list of all identities. And we don't want anybody to feel excluded. So individuals that can identify and relate to the LGBTQ plus group face unique challenges. Individuals are at twice the risk for mental health illnesses compared to heterosexual individuals. So what are some of these unique challenges? Well, such as coming out to friends or family and the fear of them being supported or not, or ridiculed or disowned. Again, so the rejection or the loss of family or friends. Are they going to lose their house? There's also trauma that patients can or have experienced through bullying, phobias, or discrimination due to the orientation identification, which causes a lot of harm to the individual where their mental health is severely affected. There's also an increased risk with this population for the use of substances. Usually it's proposed that this is a self-medicating to help with all of the feelings and trauma that they were going through. In addition, there's multiple barriers that the LGBTQ plus patients experience when they're trying to receive health care. So they either feel not included, talked down to, ridiculed, avoid it. So then after having quite negative experiences, oftentimes they just don't go to receive health care until the illness, disease process is way progressed and where it's hard to correct or treat at that point. So when we look at screening and assessment for the LGBTQ plus individual, if we have concerns, anxiety, depression, trauma, self-harm, how can we assess this? So there's research that has been done on the GAD7 and the PHQ-9 that there's an increased risk for false positives. So, well, a false positive is better than a false negative. The fact is it's still false. So that would require the provider to address and clarify the thoughts and feelings of depression, anxiety, and suicide to gain clarification and to see how this patient is feeling. So you can decide if further treatment is or is not warranted. There is also something called gender minority stress in trans and gender diverse individuals, which has a direct correlation with increased anxiety and depression, contributing to a decreased well-being. So because of the stigmas, discrimination that they have faced throughout their life, it causes severe stress, depression, can be internalized and can bring on or exacerbate a mental health condition. So when discussing treatment plans with the patient, this population as well as others, I always think it's best for a multimodal approach. Okay, so you can use pharmacological treatment if indicated for depression, anxiety, PTSD, substance abuse, misuse, and other mental health concerns. Also, you can talk about the importance and greater efficacy for using counseling to help address the trauma, the discrimination, and the negative thoughts that have occurred throughout their life and how to start developing positive coping mechanisms. During this time, counseling can also work on skill building and help the patient to how to reduce or eliminate unhealthy coping mechanisms, find more positive ways to manage, and also to help increase their self-confidence. During this time, it's essential that the providers be aware of and work on their own biases, either towards this population or others. The patients will pick up on it and will be less likely to seek care. So it's important that you are inclusive for all patients, regardless of beliefs or gender identity, so they can receive the care that is needed. Ways you can do this to create an inclusive environment is to create a welcoming environment, an inclusive environment by using preferred pronouns, having forms that reflect gender at birth and also gender identity, preferred pronouns, and being open to learning more about the patient without judgment. Last but not least, we move on to the immigrant and migrant workers. There's an increased rate of mental illness, including depression, anxiety, and post-traumatic stress disorder. Factors that can contribute to this, to mental illnesses, are working in dangerous work environments, working long shifts, very long work with hard working hours, workplace abuse, talked down to or belittled, very little job security, not knowing if they're going to get paid or have a job from one day to the next. In addition, it's important that the provider assesses for social determinants of health, which There are many factors that fall into the social determinants of health, such as poor pay, poor working conditions, language barriers, poor access to health, limited social support. If there are concerns that there is a mental illness in this population, we can use the PHQ-9 that we discussed earlier. It has been approved and is available as a validated tool in over 100 languages. This allows the provider to tailor this assessment to the patient. There's also some other unique tests that can be used for accurate assessment. One is the RHS-15, and this assesses for anxiety, depression, PTSD, adjustment, and coping skills. This is also available in 14 languages. Next is the HTQ, the Harvard Trauma Questionnaire. And so this is going to examine about trauma and any related symptoms. And this also comes in 30 different languages. In the HSCL-25, Hopkins Symptoms Checklist 25, will assess anxiety and depression. And this is available in at least 27 languages. So I think the important thing here to focus on is that there are validated tools that can pick up on cultural differences. So it's going to reduce barriers such as wrongful diagnosis or inaccurate diagnosis. Also, it's offered in multiple languages, so the patient will understand the form for more accurate answers, and will be more inclusive to making the patient feel valued. So after the screening that we did that is individualized towards the patient, when we look at treatment plans, it's important to provide educational handouts that's in the patient's language that is easy to understand, also with pictures, so they have something they can refer to after the appointment. As providers, I mentioned at the beginning of this presentation, it's always important to practice cultural competency and work to understand the patient's beliefs. I can't stress enough the importance of having a certified medical translator during the exam and after for thoroughly explaining. This also allows the patient the opportunity to ask questions or voice any concerns. The provider must document the use of offering a certified medical translator and if the patient accepts or denies the offer. These assessments and exam, the provider can make referrals for additional assistance to help meet the individual with any deficits in the social determinants of health. Perhaps they may need help with getting nutritious food, or they may need help affording the prescriptions or finding a safe living environment. If the prescriber and patient decide that medication is needed to help treat a mental illness, it's very important that the provider make sure that the patient can afford it. There's also many pharmacies or major retail chains that offer a list of medication that is on like $10 and under list. So trying to utilize those medications if it's a good fit for the patient and is proper for the illness that is being treated. When you have the medical translator, this is also a great time for the provider to have the translator explain what the medication is, why is it being prescribed to this patient, how the patient should take it, any potential side effects that may happen, and then also when to contact the provider and also when to follow up and why. We want to follow up to see how is the medication going? Are you having a positive response to the medication? Do we need to increase the dose, decrease the dose, or change the medication? Thank you for joining me today on this presentation of mental health in various ages and populations. I want to take a moment to highlight the references that I've used here today. Without these resources, I couldn't have put this presentation together. Thank you for your time.